Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today, we are reporting an increase of 24 new cases of COVID-19 in Windsor and Essex County. Of the 24 cases, 8 are close contacts of confirmed cases, 4 are community-acquired, and 12 are still being investigated. We have had 13,224 cases since the beginning of the pandemic. 12,576 cases are now resolved, and 254 people are active at this time. 31 preliminary or confirmed variants of concern have been identified in Windsor-Essex County. One of the 31 cases has been identified to be the UK variant. 39 confirmed cases of COVID-19 are currently in the hospital, and 12 people are in ICU. Our community has lost 394 people to COVID. We are reporting an additional death today. A man in his 80s from the community has passed away. 237 deaths have occurred among residents and staff in long-term care and retirement homes, and 157 are residents from the community. There are currently 14 active outbreaks in Windsor and Essex County, 6 in workplaces, 3 community, 2 retirement homes, 2 school outbreaks, and 1 hospital outbreak. We are currently in phase 1 of Ontario's 3-phase COVID-19 vaccine distribution plan. Currently, more than 9,000 people have received their first dose. 11,645 people from Windsor-Essex County have now received both doses of a COVID vaccine. We have now vaccinated 1,300 residents 80 years and older in Windsor and Essex County. 229 people were vaccinated at the WFCU Centre in Windsor yesterday, and 168 people were vaccinated at the first clinic held in Leamington at Nature Fresh Farms Recreation Centre yesterday. For anyone born in 1941 or earlier, please use our registration system by visiting our website at wechu.org or by calling 519-251-4072. As of this morning, we have exactly 13,613 people who have pre-registered and are over the age of 80 years. Following the removal of some duplicates, this number is likely to be lower. Please continue to follow public health measures. Stay home if you're sick, limit your close contacts to your household members, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, wear a non-medical mask or a face covering, cover your mouth and nose with a tissue or use the inside of your elbow or your sleeve when you cough or sneeze, and download the COVID Exposure Alert app at canada.ca. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. Following the guidance of National Advisory Committee on Immunization, NACI, and on the heels of the announcement of the authorization of the single-dose Johnson & Johnson vaccine, the province of Ontario has given us the direction to delay the administration of second doses for those who do not have a scheduled appointment prior to March 11th. In order to effectively distribute the limited supply of vaccine available in communities across the country, National Advisory Committee on Immunization is recommending the extension of the interval between doses to a period of up to 4 months. With current research indicating that even 1 dose is highly effective at preventing severe illness, hospitalization, and death, the provincial decision makers and supported by Dr. David Williams, the Chief Medical Officer of Health, see more value to administering a single dose to a high number of people than 2 doses to a select few. In doing so, a greater number of Ontarians will have the opportunity to be protected in a much shorter period. We acknowledge the impact that the constant fluctuation have on community members' ability to understand when and how they and their loved ones will be able to move past the pandemic. While this certainly presents a number of logistical challenges for both the health unit and for those who have already scheduled their appointments, we understand the importance of getting as many members of our community vaccinated with at least 1 dose as quickly as possible. We are also scheduled to receive a number of vaccine, the AstraZeneca vaccine through our pharmacy pilot project, and with our ability to administer the residents in the 60 to 64 age group. And through that partnership, the initiative will be launched later this week to maximize the number of people to receive their first doses in the region. Residents who have received their first doses of Moderna or Pfizer should not be concerned. However, as both vaccines have shown to be an efficacy of 92% 14 days from the first dose and up to the point when a second dose was administered. And as we discussed yesterday as well, the first dose of vaccine is generally there to give the immune response that the body needs to fight off the new infection for SARS-CoV-2 virus if it's introduced into the body. And the second dose is generally given to prolong the immunity. So there is no concern from a scientific perspective based on how these vaccines work in terms of delaying the doses of these vaccines, and that's what the recommendation supported by the National Advisory Committee on Immunization. We intend to provide additional information to those who are awaiting their second dose in the coming days, and as more and more residents of Windsor-Essex continue to receive COVID-19 vaccine, we want to see everyone protected in a short period of time. With the limited number of vaccine, giving them at least one dose will give the level of protection that our community needs to prevent further transmission of COVID-19 virus in our community, prevent hospitalization, prevent severity of the disease, and keep our community safe. While we're still waiting to get everyone vaccinated and to get to a better position, please always maintain a 2 meters distance from others, limit your contacts to your households only, wash your hands with house soap and water thoroughly and often, and avoid touching your eyes, nose, and mouth in unwashed hand. Stay home if you're sick and do not go to work if you're sick. Thank you.
We'll now take questions from the media. Today we'll start with the Windsor Star.
Dr. Ahmed, just to clarify, so those who have appointments scheduled for their second doses after March 11th, are all those appointments now canceled?
Yes, they will be rescheduled at a 4 months timeline. Some of these logistics of notifying them is currently being worked at, and we are trying to use this platform to give them that information. And as we said, please stay tuned. We will work on the logistics of getting everyone rebooked to get them their second dose at the 4 months time, or as logistically possible.
So a means of rebooking those appointments or how or when they may be contacted, that hasn't been worked out yet?
Yes, because we want to make sure that all these facilities that we have, we are making sure that they can come back to the same facility. We want to make sure that everyone is aware of their timing and the date when they have to come back. So we'll start to provide some of the information to the people who are attending the clinics today, but more details will come out in the next few days. I don't know, Teresa, if you want to add more to those.
Yes, we're just working internally on how we're going to notify the 973 people that received their vaccine last week and actually have appointments scheduled in 3 weeks. So we want to make sure that we reach out to them because those appointments will be canceled. And so we're wanting to make sure we have a clear message about if they're to return at 4 months, where they're to return, or if we're just canceling the appointment at this time pending further information. So we're working on that today, and hopefully we'll have everything in place to give good guidance. So this directive just came to us yesterday, and we're trying to put all the pieces together. So, we'll do our best, but the communication will likely be the people calling directly to those that have scheduled second appointments, those 80 years and older, and telling them that their appointment has been canceled, and either give them the new appointment date or just say more information will be pending. So those are kind of the options we're looking at right now.
So Dr. Ahmed, I know you mentioned that the initial dose of the vaccine still has 92% effectiveness, but for members of the public who've been told that 2 doses are required and that these appointments were expected for them, what can you tell them to give them some peace of mind that what they've already received is satisfactory?
Well, no, I think the message is the same, that these vaccines, the way it works is the first dose, when people are getting it, it triggers the immune reaction that prepares the body to fight off the new SARS-CoV-2 virus if it sees, and to protect it from them. The second dose is generally always there to extend the duration of the immunity. Between dose 1 and dose 2, what is better is from a immunity boosting perspective. If you're delaying it, it doesn't affect that much. In fact, it can prolong your immunity for a much higher, a longer duration of time rather than giving it at a shorter interval. If you're giving the vaccine at a shorter interval, it is a problem, but for most of the part, the vaccine, if the duration of interval is extended up to a certain limit, it doesn't affect the vaccine in any way. And having 2 doses better, but what we are thinking about, or the recommendation from NACI is, when you're looking at a population level, the first dose is already providing you 92% effectiveness, 92% protection. And then when more and more people are vaccinated with that level of protection, overall in general, as a community, as the region, we will be much more prepared to prevent the transmission of the disease rather than having large number of, the balance between having limited number of people with 2 doses of vaccine versus a large number of people with at least 1 dose of the vaccine, which is still protective up to 92%. So it shouldn't affect them in any ways, but the second dose is important. That's why we will be offering that after 4 months or close to that timeline.
I understand the scientific explanation. What I'm trying to get at is that for members of the public, especially from that age group, getting this fluctuating information, changing information, they're going to have disturbed peace of mind. What can you say to them to try to calm them down?
Well, I think the information is evolving, and I can understand that they may be getting conflicting messaging or unsure about what is happening. So that's why our job is to make sure that we make it easy for them. But we truly recognize that the information continues to evolve, and as new information comes in, we share that information as best as possible to help them understand. But I understand that there's a lot of information coming out every day.
Thank you.
Any questions from AM 800?
Teresa, I think this is for you. If not, maybe Dr. Ahmed can pick it up. But if I'm not mistaken, an individual had to sign consent to come back in 3 weeks. Can an individual fight this and say they want their vaccine in 3 weeks?
Well, we're following the ministry direction, and I don't believe the consent says that the timeline about returning. The consent is specifically about receiving a second dose, that they give their informed consent, that they agree that they would like the second dose. The other thing I just want to clarify, that the direction from the ministry does not include residents of long-term care or retirement homes who will continue to get both doses. It does affect our people over 80 in the community, but those that are living in long-term care and retirement homes will continue to be to receive both doses of the vaccine.
Does this throw a curveball into the health unit's plans? It seems like everything has been smooth sailing. I know you and the team have put a lot of effort into the scheduling and the planning. Is this a major curveball for the health unit?
I would say that it does present some complexities, because we're working with our municipal partners, and they have provided a tremendous amount of support to get the vaccine clinics up and running. And so we need to discuss with them further about the logistics of now a 4-month timeline for second doses. So all of that will have to occur today. But I would say that nothing has really been smooth throughout the whole pandemic. Every day presented certain challenges. So we just have to keep moving forward and do the best we can. And I do think it is significant, because we would have really like to give this population of over 80 both doses, but the ministry directive is quite clear, and they are wanting us to immunize as many people as possible so everyone has a first dose by June.
And then finally, last night, Amherstburg Council approved the Libro Center for a vaccination site. When do you hope to have that facility up and running?
Well, again, we're looking at our current vaccine supply and the prioritized groups, and we'll have to make decisions about that as well. But right now, I would say in the next couple of weeks, we're not anticipating having Amherstburg, but as you know, this can change very quickly, and tomorrow I could be saying, yep, we've asked them to, get it ready sooner. But right now we are just concentrating on the 2 sites that we have, as well as the Windsor Regional Hospital continues to immunize at the Sportsplex, and they have their own, groups that Dr. Ahmed has asked them to immunize. So right now, Amherstburg isn't in the plan for the next couple of weeks, but we will work closely with the municipalities and determine a date for them as well.
Thank you.
Any questions from CTV?
Yes, good morning. In the U.S., the CDC says people who are fully vaccinated don't have to wear a mask or social distance when visiting people indoors and don't have to quarantine after a known exposure. Do you agree with that advice?
So I think the science is still evolving at this time. There is no recommendation at this time from Health Canada or Public Health Agency of Canada, or even from our provincial bodies at this time. We always look at the evidence, and if the evidence suggests that this is okay, then obviously we can come out with that recommendation. But at this time, there is no Canadian guidelines, Canadian recommendations to support that.
And when do you anticipate more guidance, I guess, for people who are fully vaccinated?
Well, as I said, it is an ever-changing world since the beginning of this COVID, and the new evidence comes in, new recommendations comes in, just following some of those evidence. I don't know when the agencies that are responsible for these type of decisions will come out and say that. And generally, it's either a federal decision coming directly from Health Canada, Public Health Agency of Canada, or it's a provincial recommendation. And none of these agencies have indicated enough data to suggest that this is the case at this time. And that's not a local decision that I can make or recommend. So we'll have to wait for the provincial and federal decision on that.
So for right now, everybody who's been vaccinated should still follow all of the public health guidelines, correct?
That is correct, yes.
Okay, thank you.
Any questions from CBC?
Yes, good morning. Dr. Ahmed, I wanted to get your reaction to the downtown mission taking on new clients at the former library location. The executive director says that 35 people were turned away from the 2 city isolation sites, and I know this contravenes the order that you issued a little while ago. What's your reaction to that?
Well, I think it is a very difficult situation this time in terms of finding the shelter for these people, and I know the city and the health system partners have put a lot of resources to set up a new system in place for people who are looking for shelter. And a lot of work, a lot of resources are going there to support this population. So it is disheartening to see that the executive director is indicating his interest in violating these orders, which is not helpful for anyone. But we are trying to stay focused on serving what is important and critical, which is protecting people from COVID, and also ensuring that we have a good system in place to support those who need these shelter. We know that the city shelter is up and running, and the whole idea to set it up to provide that gap, the level of the service gap that exists in the community. So we'll be having a number of conversations today to figure out what to do, but staying focused on protecting everyone, who may be impacted by COVID, and also addressing some of these gaps that exist in our community to provide that emergency shelter for people.
So this issue is being worked on? I'm just wondering, if you're a person who needs a bed to sleep tonight, where are you supposed to go with Rondon saying that people are being turned away? Just wondering, what is the immediate alternative for them?
So we know that the city site is offering that emergency shelter. So we have been assured by the city that that's the case, and we want to make sure that that continues to exist for people who are looking for emergency shelter, and the rest of the issue will continue to work.
Okay, and I know you mentioned cohorting before, but I'm wondering if you can elaborate on the reasons why the aquatic center is closed to those who haven't quarantined, even though it's set up for emergencies.
Can you repeat your question? Maybe I didn't get it clearly.
Sorry about that. I know that you mentioned cohorting different groups before, but I'm wondering if you can elaborate on why the aquatic center is closed to people who haven't completed their quarantine, even though it's supposed to be, set up as an emergency. Wouldn't that prevent a lot of people who might need that center from accessing it?
So when you're talking about people who need quarantine or isolation space, so those are generally the people who have had the exposure of the virus, and those people need to be isolated separately. And the city has the isolation and recovery center hotel that's run by the city to house those people that are exposed or that are positive. So we have that kind of facility there to bridge that gap. And then the city is also running the aquatic center, which is generally the people who are not exposed, at least based on the investigation. And so they're taking all these people there. And also if someone new shows up based on the capacity that they have. So I think we do have that ability, and putting someone who is already exposed or who is currently incubating the virus back with the general mix of the population, it does raise significant challenges and potential risk for spread in that new group, because we definitely don't want a person who is exposed and could be incubating, whether leading to asymptomatic transmission or symptomatic transmission, to all the negatives that are there. I think that would be a disaster. So we'll have to be very careful in how these individuals are coming in and assessing the facility to ensure the safety and well-being of everyone.
Thank you.
Any questions from Blackburn?
Yes, good morning. You mentioned about having to call people now to rebook their second appointments or just tell them to kind of hold tight. In less than a week's time, the provincial sign-up system is supposed to launch. Have you determined where people will go after March 15th, if they'll continue to use the health unit system, or will it be integrated with the provincial system?
So great question, and I'll start and I'll let Teresa add to. That's the discussion that we had at length yesterday, and we are scheduled to speak to the ministry today as well. I think there are certain challenges with either staying with our own system or accessing the ministry system. There are pros and cons to both situations. We are looking at the benefit of going with one option versus the other. Eventually, I think at the end of the day, we'll have to move to the provincial system. So that's the reality. The challenge is we already have 13,000 people, as Teresa mentioned this morning, that are registered, use the pre-registration system to access our facility. Also, it's worth noting that we are ahead of many of the other regions in terms of vaccinating our residents. So when we participate in the provincial system, the challenge is it will be open to anyone who, irrespective of where they live. So if someone is living in, let's say, North Bay, but they decide to book a vaccination spot here in Windsor, they are able to do that if we are in the provincial booking system. And from a province perspective, obviously, it's the portability issue that they want to allow that, but we also want to make sure that we have a system in place for those people who are currently booked and pre-registered. They have access to the booking and getting the vaccine in a timely manner. So we haven't landed on one solution or the other, but we know for sure that the provincial system will be the way to go. It's just about the timing that when we can start using their system. And I don't know, Teresa, if you want to add anything more than what I said.
No, just that our staff have been participating in the provincial solution, and they're rolling it out and engaging the health units, and we do have we had a conversation last night about transitioning over and the best timing of that. And I do agree that we're just a little bit ahead, and we have a system in place, but we eventually have to make this move. So we're going to have to make that decision and figure out the actual timing and how that will look. But those discussions are ongoing as well.
Sorry, just to clarify, so because we are ahead we were already doing the 80 plus population, and when the system launches next week, they're expecting to start registering the 80 plus population. Will probably be done, our 80 plus population, before other parts of the province. But you said that other regions, somebody from Toronto could book appointment down here if they could get themselves here, and it's not based on your residency?
Yes, so the provincial solution for the booking and scheduling operationalizes the way you said. So if someone were to go on and book an appointment, they would be given all the options available in the province, and they could book wherever they would like to. So it's not ideal at a time where we're focusing very much on our 80 plus, and we are wanting to get our community vaccinated very quickly, because we believe they're the higher risk age group. So the provincial solution for booking is not necessarily compatible with our rollout at this time. So those conversations are very important, because we want to make sure that we immunize our 80 plus seniors as quickly as possible. And we know that we have quite a few people to do, even if we've increased with Leamington and WFCU Center, we still have a ways to go. So we're having discussions internally, and then we'll have discussions more broadly with the ministry as well, and see if we can come to a good solution for our health unit area.
Thank you.
Any further questions from the Windsor Star? Oh, sorry about that. Any further questions from the Windsor Star?
Nothing further, thank you.
Any additional questions from AM 800?
Teresa, just to clarify, you mentioned already, so the 900 plus that received their vaccine last week, you're telling them to hold tight, and the health unit will be reaching out to them shortly to schedule their next appointment, looking like within the next 4 months?
Exactly. So we will determine how we're going to reach them. It was with a phone call before, and we'll see how that goes. And it'll be important to say to them that their appointment that they did have scheduled is canceled, and we'll either give them an appointment for 4 months down the road with a location, or we'll tell them that we'll be in touch with them again. So we have to just figure out the logistics internally on what the 4 month really looks like, and if the locations are still set. And, then we'll provide that all in one call, but it may be that we have to just inform them that their appointment that they thought they were going to have in 3 weeks has been canceled, and we'll get in touch with them again. But hopefully we'll have all the information, so it's one phone call. But that's how we connected with our 80 plus seniors in the community, and they will appreciate and need a follow-up phone call.
I'm guessing the individuals that received the vaccine yesterday, they will have to get that phone call too, and then starting today, anyone getting their vaccine will be told it's 4 months down the road?
Yes, so that was the plan, is that today people will know that it's 4 months down the road, whether we still have to finalize where that location is, so giving them an appointment date without verifying the location. So we do have to talk to our municipal partners and make sure that everything's in place. So even today, it might not be as streamlined as we want it to be. We'll probably be more prepared tomorrow.
And sorry, one quick question in regards to the location. I'm not sure if you can share this or if you want to share it, but how long is the partnership in place with the city for the WFCU Center and for Leamington at their arena complex?
So the agreements we have with both municipalities, we have a start date and we don't have a necessarily an end date right now, but I do think this changes, expectations, and I'd want to respect, have good conversations with them to determine if the locations can remain, and if not, what other locations should we be looking at for the second doses.
Okay, thank you very much.
Any additional questions from CTV?
No, thank you.
Any further questions from CBC?
Yes, I have two. Further to my questions earlier, is there an update on the case numbers associated with the outbreaks in both shelters? I'm wondering how many cases are tied to those variants of concern, and also if we know whether any of the cases that have been diagnosed are serious.
So if I remember correctly, at the shelter, we had a total of 90 cases, like downtown Mission, and there was some increase in that number. That's the final number that I have. I don't have any update on the variant of concern, and to my knowledge, they're all isolating at this time appropriately. The positives, and those who have recovered are at the aquatic center at this time.
Okay, thank you. And when it comes to outbreaks at long-term care and retirement homes, if staff members are refusing to get vaccinated, I'm wondering what happens when there's an outbreak, and how can they still, I guess, do their job safely if they've opted not to be vaccinated?
So it would be, I haven't seen that situation yet, but generally what happens, like an influenza outbreak on this type of situation, we basically exclude the staff who are not vaccinated from the facility.
Okay, thank you.
Any additional questions from Blackburn?
No, thank you.
Thank you, everyone. Have a good day.
Thank you.